This is sort of a classic women's cardiac case, which I tend to see a lot of. It's a 43-year-old woman who presented to the emergency room with severe abdominal pain, sudden onset. She had some imaging done which showed that she had a blood clot in one of the arteries supplying her intestines. She had to go for urgent abdominal surgery to remove the clot and to do a partial small bowel resection. This clot came from somewhere. It started somewhere and it ended up in her gut artery. But where did it come from? We always look to the heart because that is a big source of blood clots that could potentially travel to other parts of the body. She undergoes a cardiac ultrasound, and it shows that the tip of her heart is not moving. It's not working. She has what's called an apical aneurysm, where the muscle looks like it's dead. It looks like she's had a heart attack. She's 43. No history of the classic cardiovascular risk factors like high blood pressure, high cholesterol, diabetes, or a family history of early coronary disease. She also underwent a cardiac catheterization to look at her coronary arteries. And what it showed is she had something called spontaneous coronary artery dissection. So this is a type of a heart attack that is not caused by a cholesterol plaque. It most commonly affects women, and oftentimes premenopausal women. So it's actually the most common cause of a heart attack in a woman around the time of pregnancy. So there's a thought that there's some hormonal component to it. So that's where it came from. So she had a big blood clot in that tip of the heart. What was difficult about this case is that we found the heart attack after we found the downstream effect of the heart attack. I guess you could call it a silent heart attack. She didn't know she was having a heart attack. When you go back to her symptoms on the days preceding the onset of abdominal pain, asking her about chest pain, asking her about shortness of breath, sweatiness, nausea, she didn't have any of that. She just had this general sense of feeling unwell, and what's been reported in a lot of women who have heart attacks, a sense of doom for no particular reason. They feel terrible and they just feel like they're going to die. She was only picked up because she had this complication to her heart attack, but it was really the heart attack that set off this whole cascade of things. And so she's done well. For the most part, they tend to heal on their own. And in follow-up, showed some improvement in her heart function. It's not completely back to normal, but it's significantly improved. The clot is dissolved. She's healed from her abdominal surgery. She went to cardiac rehab afterwards. Women are much less likely to have the classic elephant sitting on your chest. They're more likely to have shortness of breath. They're more likely to have profound fatigue and just, again, that sort of non-specific sense that something's not right and you just don't feel good, which is tough because they're non-specific symptoms. Listen to yourself when you think something's really wrong. Don't get me wrong, women can present with chest pain, classic typical symptoms, but it's just that there's a significant proportion of them that don't. The risk is that they can be missed.